Hello everyone, welcome back to my channel. Lumbar puncture is otherwise known as spinal tap. It is a medical procedure in which needle is inserted into the spinal canal, most commonly to collect the cerebrospinal fluid for diagnosis of cerebrospinal fluid disorders and also central nervous system disorders. Examples of central nervous system disorders are meningitis and subarachnoid hemorrhage. Lumbar puncture is a procedure performed under local anesthesia in which a hypodermic needle is inserted in between the L4 and L5 region. It is not only used for diagnosis purpose but also used for injecting the medication, that is particularly anesthesia is inserted and also used in chemotherapy. In lumbar puncture, the patient to be positioned in side lying or in sitting. The most common thing to be remember is when the intracranial pressure is increased, lumbar puncture should not be performed. Now I would like to show you the easiest method to remember the layers of lumbar puncture. I'll show you in the form of a picture.
So this is the easiest way to remember the lumbar puncture layers. Here we are seeing a diagram. This person is named as Led, I Led as. Here we can see on his t-shirt I Led as, and his hair strand showing SSS, and he is catching a lumbar puncture needle in his hand. Firstly, SSS. Firstly, the lumbar puncture, that hypodermic needle should pass through the skin, and as for superficial fascia and as for supraspinous ligament. And secondly, I for intraspinous ligament, ligamentum flavum, epidural space, dura mater, arachnoid mater and subarachnoid space. The lumbar puncture should pass through the skin and then to the superficial fascia and then to the supraspinous ligament and then to the interspinous ligament and then to ligamentum flavum and then to epidural space and then to dura mater and then to arachnoid mater and finally to the subarachnoid space. Here the fluid is collected and then sent to the laboratory, and there it is diagnosed and the disease is confirmed. Thank you for watching.